Well, thank you for this opportunity to speak with you today on this topic. I'm sorry I couldn't be there in person, but look forward to connecting with you guys the rest of this meeting. So I'm going to talk today a little bit about different ways of thinking about how to get the next 5 pounds of milk in a given dairy herd. We've seen huge moves over the last 20, 30, 40, 50 years in milk production, and given how competitive this industry is, for any dairy to be competitive, to stay viable, we do have to keep looking for more milk. And I think there's a couple of ways that we might want to think about this. The traditional way, at least as nutritionists, that we might think about this is that we need to focus on refining our feeding strategies to look for maybe there's an amino acid that we haven't looked at carefully enough that's constraining milk protein synthesis, or maybe there's some slightly different carbohydrate source we could use that gets rumen microbes to be a little more efficient and get more microbial yield that way. So those sorts of things are absolutely productive, useful, and they continue to be important. So I'm not sort of dismissing that. However, I think if that's the only way we think about how we as nutritionists can help dairy farms produce more milk, I think we're missing some important pieces of the puzzle. Okay, so I would argue that another thing that we can focus on is this idea that if we can prevent clinical and subclinical transition cow diseases, we can actually get herd productivity to increase in that way as well. And it might be stretching it to say that can impact us by 5 pounds a day for the whole herd, but it probably at least a third of our cows might be suffering from those kind of impacts. And let me defend that supposition for a second, if you will. So I've showed this many times, probably many of you have seen it, but I think it's a really important message. So this is data from a collection of different studies where in each of these studies, they're just observational studies. They took the time to go back and look at cows that had some kind of mild transition cow problem that they recovered from. These are not diseases that cause the cow to leave the herd immediately. But then they asked, well, how did the performance of those cows in that lactation compare to the performance of herd mates who were healthy in the transition period? So across different types of diseases, from early lactation mastitis to metritis to ketosis, they've reported in these studies that cows with those conditions made anywhere from 700 to nearly 1,100 pounds less milk in that whole lactation than healthy herd mates. And again, that's obviously not coming in the 3 or 4 or 5 days that you're dealing with an active disease process. Sure, they're losing milk in those days, but that's not adding up to 1,100 pounds of milk. Most of this negative impact is because those cows don't hit the same peak productivity that they could have achieved if they had been healthy. And then that has an effect on the entire rest of the lactation. Okay, so we're really hurting whole herd average productivity, even if we're not noticing it and tying that weaker productivity back to the condition that cow had right after calving. Okay, so that's an important point. The other one, and we could spend a lot of time debating this, and it's worth thinking about, but if we can get to the point where we can keep cows in the herd longer, where they're actually being very productive and we're not just holding on to them at a low level of productivity, in theory, at least, we should be more productive as a herd by having an older herd on average. Okay, so let's dig into that a little bit. First of all, I'm going to go back to this collection of observational studies. Probably the more impactful outcome that these papers reported was not only that cows with these fresh cow disorders were less productive in that lactation, but they also had a much greater risk of leaving the herd early. Okay, so if a cow had mastitis in early lactation, she was 3 times as likely to leave the herd before she had her next calf. So sometime in that lactation. And metritis, maybe not as extreme, but still a significant effect. And ketosis, again, 3.5 times greater. And again, a lot of times I don't think this is going to be an easy thing to tie back to that disorder. I would argue in many of these cases, what's going on is, cows sort of get back on track. They're lost in the greater herd. They get to 80 days in milk, get AI'd, don't get pregnant. 30 days later, they're AI'd again, they don't get pregnant, and on and on. And pretty soon, 4 or 5, inseminations later, they end up on the do not breed list, and they end up leaving the herd. And nobody in a normal herd has the time to track back and look at her history and say, 2/3 of these cows that we DNB'd in the last few months had some kind of transition problem, right? And I think that's typically a lot of the explanation for this. And ultimately, that's what drives our relatively high turnover rates and culling rates. Because, we have cows that we can't get bred back, or they're just not very productive and they're not profitable. And then, of course, it doesn't make sense to hold on to them out of some desperate need to have an old herd. That's not going to keep you in business. But if we can come back and correct those problems that led to that situation that made her necessary to cull, then hopefully, we could achieve a older herd on average. And the reason we care about that is if we can keep our cows healthy, this is, relatively healthy cows. What do you expect them to do over multiple lactations? Well, we actually expect them to continue making more milk until at least 4th lactation. Okay, and if 4th lactation cows are only making up 15 to 20% of our herd, we're clearly not hitting the kind of productivity that we could if we could get them to be a higher fraction of our herd, right? Albert de Vries has done some really nice work on this. I think he's continuing to work on and refine this. And in fact, there's an ADSA Discover conference on this sort of topic about herd turnover and culling this fall of 2023. So that'll be interesting to see the discussions there. But in his analysis here, he's basically trying to account for all the differences that occur across different lactations in terms of how much milk the cows make, what's the value of the calves they're producing in terms of their genetic potential and their value, what is the risk or the cull value of the animal that's being sold. One advantage of having a high turnover rate is typically selling a 4-year-old animal as a cull animal is going to lead to a better paycheck at culling than if you have a super old cow that doesn't look very healthy. So there's all these trade-offs, and in his analysis of these trade-offs, looking at profitability, his take-home conclusion at this point at least was that averaging 4 to 5 lactations, maybe even 6, would be far more profitable than averaging 2.5 to 3 lactations in our herds, potentially by over $100 per year. If you say we're averaging 2.3 lactations now, if we could move that to 4 or 5. Okay, so he may end up with a different conclusion, and you can certainly debate some of these points, and certainly some of these points would vary by herd. But I don't think too many people would argue that if we can keep cows healthier longer, and we actually want to keep older cows on the herd, if we can pull that off, we are going to end up adding to total herd productivity. Okay, so that's the easy thing to argue. Like it's fine for me to stand here in front of a computer and say, well, we need to keep cows healthy and keep them in the herd. I clearly recognize that pulling that off is the hard part. Just saying we're not going to have as many transition disorders doesn't really do anything. So we've got to think about ways to achieve that. So this is an image from a review article we wrote a handful of years ago where we talked about all the exciting new developments related to nutrition and metabolism. And this Nutrition 2.0, as we pitched it, opens up all these new avenues for ways to think about nutrients. And I'm especially going to focus today on nutrients as signals. So not using nutrients just as building blocks or cofactors in reactions, but actually serving sort of like a drug or like a hormone where they actually change cell function by being sensed by receptors on cells, and they can actually rewire the function, the physiology of those cells. Okay. So it's an interesting concept. It's really a big underpinning idea, I think, under much of the research that my group's doing and many other nutrition labs around the world. So following that kind of logic, we published a study a few years ago where we asked, what effect would choline have on immune cells if we take it out of the whole body context and just test it in a test tube? And the reason we wanted to do that is there are so many complicated interactions of choline in the system. It can be converted to lots of different nutrients. It's used by many different organs. And we see some evidence in the literature in feeding dairy cattle choline that maybe we see some declines in infectious disease incidence, but it's really hard to decipher how that might work. So we wanted to test in this study what happens if we isolate specific types of immune cells and then give them progressively more choline in the media that they're swimming in as we stimulate them. And the basic take-home message of this paper was, first of all, for multiple types of immune cells, if we have relatively more choline in the media, when we stimulated those cells, they had less of an inflammatory response if we gave them endotoxin. Okay. On the flip side, if we had more choline in the media, the innate or adaptive the adaptive immune cells that are involved in immune memory seem to be more responsive. They proliferated at a greater rate if they had more choline there. So we recognize and acknowledge this is in vitro. It's far removed from normal biology, but it did at least suggest that there could be direct effects of choline on the immune system that help to shift from an inflammatory and innate immune response towards more of a adaptive immune memory type response. And whether that's good or bad may depend on the context, but we thought that was interesting background to take back to the whole animal then. And then, of course, this is classic literature from nearly a decade ago now showing that circulating total choline, including all the metabolites of choline in plasma, is really suppressed in fresh cows if we don't specifically supplement it. So that really makes sense that we would think especially about the relative importance of choline for immune responses and just stress responses, particularly in that window of time. Okay, so that's all the lead into a study that I want to mostly spend our time sharing with you today. And our question here was whether choline might actually be working primarily through improving responses to challenge. So I think in this symposium, we'll hear other information about big studies looking across lots of research showing that choline in transition cows tends to improve milk production, but we still don't really know exactly how that's working. So we propose that maybe this anti-inflammatory function of choline is part of the story. So we randomized 60 transition cows to receive either no choline or 30 or 45 grams per day of a new version of a rumen-protected choline that Balchem was testing. And these basically equated to the current normal recommended dose of choline because it's more concentrated, or a 50% higher dose at those two doses. The big wrinkle to this study is that 17 days post-calving, we gave these cows an intramammary LPS challenge. In fact, we did that to 30 of the 60 cows so that we would have unchallenged cows as well. So 20 cows assigned to different dietary treatments, and half of each of those groups got this LPS intramammary challenge at day 17. So one outcome we've already reported from this study published last year that was unexpected, at least in magnitude, was that both choline concentrations dramatically increased colostrum yield. So here we're showing that across the two choline doses, we had about an 80% increase in colostrum volume, which equated to an increase in colostrum fat yield as well, well, at least for the 30 gram per day dose, and also an increase in protein yield. Basically, we didn't see any change in composition of the colostrum in terms of fat, protein, or IgG. So we saw a 80% increase in most of those, on average, most of those nutrients. And the IgG response especially was important. So really compelling, interesting insight there. And we've had some farms in Michigan take and run with that already. And have reported back anecdotally some positive effects during the fall period when we usually see such a problematic drop in colostrum. Then we would look at responses of cows before the challenge up to day 16. We again saw very significant and consistent increase in milk yield. What stood out in this study compared to the average in the literature is the magnitude of this. So this is in kilograms per day, but if you convert that to pounds, this equates to about a 9 pound per day response in milk yield for choline-treated cows, regardless of dose. Pretty impressive outcome there. That was not driven by an increase in dry matter intake. We saw absolutely no effect there, no hint of an effect on dry matter intake. I'm going to spend some time just setting up this endotoxin challenge, intermammary LPS. So LPS stands for lipopolysaccharide, and we can, and some people do, challenge cows with E. coli itself, so you can give that bacteria and see how the immune system responds to that. One difficulty of that is you have huge variation across animals and how well they deal with that, and you can get an infection that can get out of control in some animals, and you end up with sort of a mess in the end for data analysis. So one way we could sort of mimic some of the responses to this without actually having a live pathogen is to extract the endotoxin or the lipopolysaccharide from the cell wall of that E. coli. And this is one of those things that the immune system is looking for. And if we concentrate that, put it in a syringe and inject it up the teat canal into the mammary gland, we can essentially trick that immune system into thinking there is a live bacteria there, even though it's actually a sterile tool that we're using. Okay, so just to highlight a few of the major responses we would expect to see, particularly with a gram-negative stimulus like this, is we see very rapid and very dramatic immune cell recruitment. So this group of cows in early lactation was at about a 2.5 somatic cell score going into the challenge. Within 4 hours, that had jumped all the way to an 8. And again, this is on a log scale. So this is a massive increase in somatic cells in milk, which we expect is mostly neutrophils coming out of the blood into the mammary gland. And then a further rise all the way up to nearly 12 somatic cell score by 8 hours post-challenge. Okay, so very clearly the immune system saw this and drew in huge numbers of immune cells. What's interesting is, through 48 hours, that has only just started to drop off. Okay, so these cows had a long way to go in terms of getting back to normal somatic cell concentrations. Another classic thing we'd expect to see in response to immune stimulation is signs of inflammation, and fever is a core part of that. So this is body temperature with continuous monitoring with an intravaginal CEDAR device with a little temperature probe on it. And you can see that within about 6 to 7 hours, these cows spike a big fever. On a Fahrenheit scale, they're over 106 degrees on average at this peak. So very strong fever, but it resolves very quickly as well. So by roughly 16 hours, most of these cows are back to baseline. Now, the high dose of choline, for reasons we don't have any understanding of, they didn't return quite to the same baseline. They maintained a slightly higher body temperature. This is not a level you would call a fever at all, but we did see a significant treatment effect there on the return to more or less the baseline. I'll highlight, we measured lots of different systemic outcomes looking at how the metabolic system dealt with this inflammation, this activation of the immune system. I'm going to highlight just a couple. This is lactic acid. So if you're an athlete, you may think about lactic acid as a product of anaerobic exercise where you're really pushing your system. But another cell type, another part of physiology that tends to shift to using glucose to convert to lactic acid is the activated immune system. And it's pretty neat how easily you can see that here. So concentrations of lactic acid essentially triple in those 8 hours where we're seeing the most extreme inflammatory response. And again, we think this is a sign of lots of immune cells in the body really getting pumped up and cranking through glucose to convert it to lactic acid instead of carbon dioxide that they normally would. And this is basically just another way of looking at what other studies have shown in terms of drops in blood glucose at the same time, which we did observe to a less extreme degree. One thing that's interesting throughout, even before challenge and throughout this challenge, the choline-treated animals had a a lower concentration of lactic acid, which may reflect perhaps that a slight diminishment of inflammatory response, but the fact that we saw that even before challenge makes it a little harder to conclude that. Another thing I want to just point out, no treatment effects here, but a consistent thing we see with these endotoxin challenges is very dramatic drops, transient, but very dramatic drops in circulating amino acids. So here methionine is dropping by nearly 2/3 in the 8 hours after challenge, but then recovering by 24 hours for the most part. So how meaningful that is to the cow's future productivity is pretty hard to say. It's very transient, very short term, but certainly this animal is dealing with very dramatic disruptions of amino acid metabolism as well. Okay, so let's look at whole body outcomes during this challenge. Just real quickly, as we would expect, we see probably a 40% drop in dry matter intake on average in those cows that got the LPS challenge. That's another expected response to inflammation, part of that sort of sickness behavior, but that basically recovers within 3 or 4 days. And we didn't see any treatment effects there, so no lessening of that harm to intake with the choline treatment. Likewise with milk yield, we see nearly almost a 50% drop in milk yield the day of challenge. That largely recovers the next day and continues to recover somewhat after that. But again, no evidence of a choline effect to diminish or alter that response to LPS. One interesting finding, we have been incorporating genetic predictions more in our statistics, and I think there's a lot of future work that could benefit from this sort of thing. But here, I'll share just a couple of those outcomes. Here on the x-axis, we're showing the genetic prediction for somatic cell score. So cows that tend to have lower somatic cells versus cows that tend to have higher somatic cells. And if you look across the controls, this is post-challenge, so it's kind of unique data. It's not just normal lactating cows, it's those that have been challenged with endotoxin. The cows that tended to have higher somatic cell genetics did have a greater somatic cell after this challenge. Okay, so it ranged from 4.7 million somatic cell count to 8.5, so almost a doubling across that genetic range. But that's in the controls. So if we then look at the impact of treatment, we found that in the cows with the greater genetic propensity to have high somatic cells, we saw a 33% reduction in somatic cells if they were treated with choline. So it's kind of interesting. Granted, this is in 30 cows. You don't want to put too much stock in genetic data based on 30 cows, but that interaction is at least interesting and worth thinking about. We were also interested in the carryover effects of supplementation, and surprisingly, through 84 days in milk, so we stopped the treatments on day 20 after day 21. So in the following basically 2 months, we didn't really see a shrinking of the effect size of choline feeding. So they maintained about a 10 pound per day difference all the way through basically peak milk and slightly after that, which is somewhat surprising, I think. The other, I think, important insight here is that LPS challenge continued to be significant all the way through this window of time. And even by the end of this, there have been some recovery from the LPS challenge through this window of time. But even if you look at this, a month and a half out from that challenge, that hangover is still about 5 pounds per day. So I think that's telling. This is the first controlled LPS challenge study to look at this sort of carryover effect after an early lactation LPS, and pretty clearly shows what observational studies had hinted at in the past, that if we have mastitis and early lactation, it's going to hurt productivity probably for the entire lactation, and the magnitude here is pretty large. Okay, and again, this is a sterile mastitis. It was a dramatic one, yes, but there was no actual bacteria to kill. So you don't have the complication of some cows not clearing it quickly. Another outcome I want to share briefly, again, another genetic interaction here. So this is PTA for milk. showing cows that are relatively less genetically productive and to those that are more elite. And this is kind of interesting what this showed. And again, this is in just 60 cows, not a huge data set, but it hinted at the idea that the cows that were less elite, we saw a really dramatic increase in response to choline. So again, I'm not quite sure what to make of that, but interesting data nonetheless. These cows on this end went from about 45 kilos per day, about 100 pounds per day, up to 55 to 60. So nearly a 20-pound response per day on that end. Again, small data set for this kind of data, but suggestive that there's some interactions worth looking into further there. Real briefly, share some of the published data on calves. I do want to quickly point out with this design, these calves had no exposure to choline treatments after they were born. So they had in utero exposure for the last 24 days of gestation, but then they all received colostrum replacer and milk replacer because we explicitly wanted to test the effect of just in utero effects, not through colostrum, not through milk or anything like that. So we looked at a number of metabolic outcomes. We didn't have a huge number of calves to look at growth, but I'll share that briefly as well. And if you're interested, this was published last year. So one outcome that was interesting, we looked at oxidative stress index in these calves over the first 3 weeks of life. And so oxidative stress index is looking at pro-oxidants, so those things that show that there's reactive oxygen species which are negative for health and metabolism, against the antioxidants in blood. So it's a balance measure. So a lower number is better, meaning there's less of an overload of pro-oxidants compared to the antioxidants. And we didn't see a big time effect here, no significant time effect, but in the lower dose, the sort of regular dose of choline, we did see a significant decrease in this metric of oxidative stress compared to the negative controls. So suggesting perhaps better oxidative balance. We also saw a treatment by calf sex interaction for haptoglobin, which is a key measure of inflammation. So in the bulls, we didn't see any treatment effect, but the higher dose of choline significantly reduced haptoglobin in calves, in heifer calves, compared to those from control dams. So despite those hints of potentially biological improvements and some hint of maybe better average daily gain just in the first week of life for the higher dose of choline, overall, if you look at the body weight gain trajectories, there's really nothing too compelling here. For whatever reason, the choline 45 calves were born slightly smaller and they had some compensatory gain in that first week. And from there on, they were basically neck and neck. But again, very small study to look at growth. So to hit the highlights again real quick, the 80% increase in colostrum yield was surprising, at least to me, and I think worth exploring on farms that are struggling with that. Choline increased milk and energy-corrected milk yield by about 10 pounds per day, and that sustained through at least 84 days in milk. But it didn't do that by minimizing the negative effects of LPS. So our core hypothesis on mechanism wasn't really supported here, but the effect size of choline in this study was greater than many other studies, which is interesting. The genetic interactions, I think, are interesting just to sort of generate some thoughts. We've got some work to do to sort of solidify some of those, but I think it points towards promising ways of looking at those kind of data. This study is the first to show in a controlled randomized study that if you purposely give endotoxin intramammary to cows in early lactation, it's going to hurt their milk yield for at least a couple of months after and likely for the entire lactation. And again, that fits well with the observational studies that are out there. Lastly, there were some hints of improved oxidative balance and inflammatory status in calves that were exposed to this in utero, but we couldn't document any sort of compelling growth effects or other effects on health, and those would require larger studies. So to come back to this core question, I think this study points in a couple ways to, number one, we shouldn't give up on refining feeding strategies, because from our data here, I would say you'd have to point to choline basically just filling a metabolic need in category 1 here, based on our results. So again, that points to the importance of continuing to look for what nutrients might be essential or might be required, and filling those gaps. But the LPS effects I've pointed to do double down and point to this idea that if we can prevent those clinical and subclinical transition cow problems, that really can help us to improve whole herd productivity. And thirdly, if cows avoid those transition problems, I anticipate that we can have better success with reproduction and health, and end up with a slightly older herd, which should also help us achieve that overall goal. So with that, I'll call it good, and I'd be happy to engage with you in the rest of this conference or answer emails or in other ways. Thank you.